Welcome to the Lighting Your Way podcast. I'm your host, Guardian Nurses founder, Betty Long. During season 3, we'll be delving in deeper to the amazing lives and stories of nurses and other healthcare professionals from around the country. We'll also be talking with a few of my nurse advocate colleagues at Guardian Nurses. You'll get a behind-the-scenes peek at the healthcare system, as well as get advice on how to get the best care when you or a loved one is a patient. Family meetings are an important part of a patient's care plan in the hospital. But with the average length of stay nationally being only 4.5 days, most patients are discharged before any type of meeting can occur. And for patients who are in the hospital for longer stays, the meeting happens either late in that admission or at only critical decision-making junctions. Family meetings are useful to discuss patients' status and goals of care. And when held proactively, and when they include a multidisciplinary team, they have been shown to improve time spent in critical care units, allow for dying patients to access palliative care earlier, and can enhance patient care and patient and family satisfaction. Our guest on this episode is one of my Guardian Nurses colleagues, Jennifer Prater. Jen shares her story about helping a patient and his family have a family meeting during the patient's prolonged hospitalization. Stay tuned. So Jennifer Prater, welcome to the Lighting Your Way podcast. Thanks for coming on.
Thank you for having me. I'm excited to be here.
Yeah, I was overhearing you at headquarters this week and thought that the case that we're going to talk about later was worthy of our listeners and of coaching them a little bit to get through the healthcare system. So, but before we get to that story, I want to talk a little bit about you, as we often do here on the podcast. We do ask our guests to tell us a little bit about themselves and how they got into nursing. So the floor is yours.
Okay. So I got into nursing through, I always wanted to be a nurse, and my grandmother wanted me to be a nurse. And I was in high school and I thought, I don't like science. I don't like math. I'm out. So I went to college.
Right.
So I went to college for something else. And my second year in, I just, all of a sudden, I had like this epiphany and said, you know what? This isn't the right thing for me. I'm supposed to be a nurse. Why don't I just do it? So I transferred schools.
Okay.
And went to School of Nursing. And I haven't looked back. I got my diploma, and then I worked for several years, and then I got my bachelor's degree, and then I recently, in 2020, it was just before the pandemic started, I graduated with my master's in nursing in leadership and management.
Congratulations.
Thank you.
That's great. And was your grandmother around to see that?
She was not, no. But I think she was watching anyway.
Well, did she know that you went to nursing school? Did she at least see you graduate from the diploma program?
No, she did not.
Oh.
No. So I think it was her from above giving me the push, saying,
okay. Right. Yeah. You got to do this. I had a similar experience in thinking, I'm really an English major. I don't really like science and math, but nursing is about people and it is about science and it is about math, but mostly it's about people and compassion. And, so congratulations on a successful career. And thank you for joining us at Guardian Nurses. You have been with us how long?
Just over a year.
And the best year of your life, no doubt, at least in your career.
Absolutely.
And you work
I learn every day.
Yes, you do. Correct. You do. Every day is different, which I've heard that from many, many of our teammates. And you work with one of our medium-sized health and welfare funds. Was it 6,000 members, maybe 5,000?
Yeah, we're at 8,000.
Okay. So 8,000. And as the mobile care coordinator, tell us a little bit about what you do.
So my role is to support members in, I always say any way they need help, but that's not, it's not every way. But what I do is patients are in the hospital. I go to the hospital and I visit with them. I make sure that they're receiving all the best care and all the right care. Things are changing always in healthcare. So, you always just like to make sure the treatment plans are the most up to date, the most appropriate for the patient, and individualized. Because, like we just were saying, nursing is about people. And if you don't individualize, you can't just rubber stamp somebody and say, this is the diabetic, and this is, we tend to do that. This is the diabetic. This is the cancer guy. This is the whatever. But these are people. And so I make sure they're getting all the best individualized care for them. I can answer questions. I help the family members to really understand and make sure things are going the way they should be going. I assist with discharge. I do education. I can help with appointments. I can go to appointments with members to be that extra set of ears, because so many times you need that someone else just kind of listening in and hearing. It takes several people sometimes to hear the whole message. And I can be that person.
Even when I go to the doctor, it would be nice to have somebody there listening, just because you're not, you're trying to listen, but there's a lot of stuff that you might be missing. So I think when you are with a patient at a physician's visit, that's really when the rubber hits the road. I think when the most effective use of a nurse being there can be very impactful. So one of the questions that we get asked a lot, and I'm curious about your experience over the last year, is how do physicians and how do other nurses in the hospital who are working for the hospital, how do they receive you?
It's been good. I think in my experience, I've had good experiences more often than not. I think the pandemic somewhat called an awareness to an awareness in healthcare in general to making sure we're all doing the right thing, and everybody's really trying. I do think, and maybe not. Maybe in the very beginning of the pandemic it was different because everybody was all so new. But I think now there's an awareness that we really need to take care of people, and so I've been received very well, very welcoming. I just had a physician yesterday actually stop me as we were leaving the appointment, and she said, "I just want to thank you for coming with her. It's really important that she gets the whole message and can review it again."
That's great. I think in those instances when you're with an accompaniment, as we call them, an accompaniment on, when you go to a doctor's visit with a patient, I have often found physicians very receptive, grateful, occasionally grateful, because they know that you're going to make sure that patient gets what they need. Right. You're going to follow up. You're going to make sure that whatever order was given or whatever medication was prescribed, that you're going to make sure that the patient gets it. So I have found that most practitioners are warmly receiving us at their offices. It's oftentimes, though, the hospital where I get the most questions about how do doctors and nurses receive you. And my experience, and in talking with some of our colleagues, oftentimes, and I know this is unusual or people don't really believe it, it's the nurses who push a little bit harder than the physicians, particularly the case managers, because I don't think they understand what we do. Have you found that?
That I totally agree with. Case managers, I don't know if they're just overworked and they're just trying to run and they just can't talk to another person, but I don't think they appreciate the value that we can offer. And I always try to introduce myself and let them know that I'm on board and anything I can do to assist. But a lot of times we hit a wall with case managers. So
Yeah, and I think
but we
that's
keep
it's
going.
I think it's sad. But what the nice thing is that once they've worked with you or some other of our other team, then it's usually a little bit easier the next time because then they understand. It's just a question of not understanding what we do. And how we
Right.
can be helpful to them because and I know you've done this with your folks in the hospital, is that when you explain to the case manager that you are a bridge to the community, that you will be taking the baton when that patient goes home and continuing to coordinate their care, whereas the case manager is just in the hospital. it somehow the light bulb goes off and then they're much more collaborative.
Yes, and I just had that experience with that. Actually, this case that I was just discussing at headquarters the other day, where at the end of a meeting they said, I explained a little bit of what else I could do as the patient left the hospital, and they said, "Wow, we could use you for all of our patients."
Right,
So
right,
I chuckled
right.
because we really did a 360 there.
Right, right. Okay, so that's a good segue. So tell me, or tell our listeners, give us a little background into this case that we're going to talk about.
Okay. I met a member. He was 67 years old. He was in the hospital. I met him. He had been in just a couple days, and his wife has been with him. He received a very unexpected, significant diagnosis, and a very complex diagnosis, meaning that, it was going to definitely be multidisciplinary. It was going to need multiple different members of the healthcare team to coordinate and communicate and get this gentleman the treatment that he needs. And it's going to be over a long period of time. So I right away kind of knew this is going to be kind of complex for
Okay.
him.
And so you that was you had met him
Yeah,
in the hospital, much like you said earlier, that you walked into the hospital to meet him because you had gotten notice that he was in the hospital.
correct. I got
Yes.
notice in the
Okay.
morning that he was in the hospital, and I went down to see him. Yep.
Okay. Great.
So I got involved early on, and I immediately, he was in kind of a general part of the hospital. He's now been moved, and he's in a very like a specialty area. But when he was in the general part of the hospital, it was really, I was trying to get information, and the wife really couldn't say much. She just kept saying, "Oh, I don't know. They think maybe," and I'm wondering, I don't know. And she was very she just, I don't know if she was told anything, but she really was not absorbing anything or taking it in. So I was trying to talk to the nurses, and I felt like sometimes, you feel like you're pulling teeth. I would ask a question and I would get a yes, no, So,
and Jen, you do get a HIPAA form signed, right, by the patient?
Absolutely. That's one of the first things I do. I get the HIPAA form signed, and I provide the staff with it. And I always make sure I explain it to the staff and what it is and why I'm getting it. And then I have the copy placed on the chart so that everybody can see. Yeah.
Okay. So go ahead. So the wife is clearly a little overwhelmed.
Very overwhelmed. Yes. So after a couple of days, the patient was moved to the specialty area of the hospital for treatment. And again, it was the same. He got moved like on a Friday night. So then, of course, it's the weekend, and sometimes that rocks the boat a little bit. So Monday morning, I was talking to the wife. She has no idea why they moved him, what they're doing, what's even wrong with him, what's the plan. So I, started trying to talk to staff to find out some of these answers and put it together. And I found myself over several days just piecing things together. I would see this person when I was there and quick talk to them and get their perspective. And then I would see this one and get their little piece. And I slowly, I probably should have more quickly, it's a learning thing for me too, but I quickly slowly learned that, you know what, I'm only getting pieces of this. Because when I sat down and tried to put the whole story together with a plan, I couldn't really do it.
Okay.
It was just piecemeal. So that's when I talked to the wife again, and I said, I'm going to be going to the physician. I'm going to request a family meeting. And my goal for that was to have some of the multidisciplinary team members there, have the wife. The patient has a sister who's very engaged and involved, but she's in Texas, so I could put her on speakerphone. And then they have a daughter who's also involved. So I was going to put her on the call. So the wife immediately was, she goes, oh, that would be great. I don't know what's going on still, whatever. I tried calling throughout this whole thing. I've tried calling the case manager, thinking that's sometimes the first step. And I just haven't been able to get through. I would leave a message. One time I did get through and was told, well, when we get close to discharge, I'll let you know. And that was that. I spoke with many nurses, and again, they could tell me, but not the whole picture. They could tell me the immediate tasks for the day.
Right.
I spoke with the nurse manager. The nurse manager was very good, and she had attended rounds in the morning, so she had a bigger sense of what was going on. And I explained to her, I said, I would like to set up this multidisciplinary team meeting. I'm looking to be able to sit down with the family and the team and discuss it comprehensively. And she said, oh, I could have someone call you. And, so I felt like a rock star and got a phone call from a doctor. And I started to ask him a couple questions. And he said, well, I don't know that I can really answer your questions. He says, I'm a resident and this is just a rotation for me. So I don't really know those longer term answers.
Oh, geez.
Like,
well, at least he was honest.
Yeah, he was.
Right.
So I went to the patient relations department and thinking maybe they could help me, gather everybody together. And I didn't, unfortunately, get anywhere there. And again, I think some of it was they didn't quite understand my role and what I was doing. So the message I received from them was, we talked to the wife, we took care of it. It's all fine. And when I spoke to the wife, she's like, well, not really. I still don't have the whole plan.
Right.
Yeah.
Yeah. And what my experience is that the longer somebody's in the hospital, or not even in the rehab, the longer someone's there, the more important this type of meeting is, because as you pointed out, it's day to day, shift to shift. There's not a cohesive overarching plan. So kudos to you. So the longer, how long had this patient been in the hospital when you were trying to get this communication going?
About 3.5 weeks.
Right. Yeah. See, that makes right. If you're only in for 3 or 4 days, maybe 5 days, hopefully they can't do that much harm in terms of communication. Right. But once you get past the week, 2 weeks, definitely. So I'm sorry to interrupt. Go ahead. So you've talked to pretty much everybody in the hospital at this point.
Yeah, and what you were saying, it's so true, because he became that patient who was just there. So when I would call or go down and try to get updates, it was like, oh, he's about the same. Like nothing was new anymore to the staff. And staff would come and go. Physicians were going on and off service and in and out. And so it wasn't always even the same doctor.
Right.
So finally, last week, things kind of came to a head where the wife was just, a couple people came in and said different things to her about like, oh, it looks like he's ready to leave. And she was like, what? And knowing full well that there was a lot more things that needed to happen in the bigger picture. So I just, So I went down early in the morning and I took a colleague with me, and we went down and we went directly into, we first tried to get to the patient's floor because I knew he was getting therapy and I wanted to pursue that as well and maybe get that piece of the puzzle. But we weren't allowed in. We weren't allowed up because visiting hours didn't start till 11. So it was 8:30. So I went to the patient relations department and I explained the situation, and I did get a gentleman there who said, okay, let me look into this. And really within about 15 to 20 minutes, he came back and he said, okay, let's go upstairs and pull together a meeting. So we went up and we got the nurse manager, we had the attending physician, and myself and my colleague, and I got the wife on the phone and I got the daughter on the phone.
Okay.
And so we were able to talk, and a lot of things came out of that meeting, and I'm so glad that we did it. I think it was very beneficial. The one thing that really, was an aha moment for me, like, yeah, this is exactly what happened. So the doctor, the wife was saying, well, I thought he still had to have this test, and you're telling me he doesn't need it. And I didn't even know that was the diagnosis. And the doctor, kudos to him, he took ownership of that, and he said, I apologize. He said, I came on service a week ago. So he came on, 2 weeks or so into it. He said, I thought you were up to speed on all that. I thought you had already had one of these meetings, or at least been spoken to and told the diagnosis, the prognosis. He didn't realize she was still in the dark for a lot of it.
Oh, wow.
Yeah.
Good for him. Good for him.
It was. I was really happy he did that.
Yeah. Well, and it must have made her feel good, right? That because sometimes families feel like they're being a pain, and that's not how they should feel. But the healthcare system has so many patients to take care of, and you got to be the squeaky wheel. But it does impact how you feel about the system. So to have somebody kind of validate, particularly a physician, to have somebody validate that, yeah, we didn't do a good job, or yeah, I just assumed that you knew what was going on. That probably made her feel better.
It did. It was huge.
Yeah.
And so I thought that was great. She was able to express some of her concerns. They talked a lot about moving forward and his wishes and things like that.
Mm-hmm.
And it just was a super important meeting, I think, and everybody was on the same page. And the wife, I waited for her, so she, wasn't there for the meeting. And after the meeting, I waited at the hospital because I knew she was coming. And because I just felt, she just went through a huge ordeal, and I wanted to make sure she was okay with it all. And she came in and she looked good. She looked at peace with everything. And she said, you know what? All I needed was to know what was going on and know what I'm dealing with. And now I can deal with it.
Oh, that's great. So, right. I honestly, we say that all the time at Guardian Nurses, right? You just want a game plan, right? And if that game plan changes, so be it. But at least you have a plan and you're working toward it. And if it has to be changed or altered for some reason, then they can do it. And look, Jen, you and I and other folks have said for years that the number one problem in healthcare is communication. That is the challenge, I should say. The challenge is communication, because there's so many moving parts, right? So many people involved speaking to your case, a lot of people. And you are trying to coordinate multiple people just to have a family feel good about what's happening. And and dare I say, the larger the health system or the larger the hospital, it can get even more challenging.
Yeah, absolutely. One of the takeaways I'm taking away from this is that it's okay you have a right to know, and it's okay to ask for people to come together and communicate to you. I think families and patients get caught up in I was kind of describing it like the wave or the tide, right? And I was finding myself starting to get caught in that. Like, you're getting some answers. So you're going along and you're getting enough pieces and enough answers, and you're kind of putting things together, and you're moving along with the flow of everything.
Okay.
And it, all of a sudden it's like, wait a minute, this isn't right. I'm not getting the whole complete picture. Okay. I'm not getting the forward plans, because we have to look forward. We have to look ahead and what's going to be coming down the road. So, so it's okay. It's easy to just get swept up into almost like a complacency. You're just like, okay, well, the doctor did say nothing new today,
Mhm.
but that's not really an answer.
Right. Right, but to your point, unless you're a nurse who or has had someone in the healthcare system tell you that it's okay to ask for this,
Right.
and then when do you? And I guess I'd ask you that, like, so yes, the longer a patient is in the hospital, the more likely it is that you need a family meeting. But what do you recommend to patients that you work with? What if somebody was just there a week? Would you tell, is there any parameters that you have that you go by?
I don't think there's hard parameters. I think it has to be on how you're being communicated to. If it's
Mhm.
a simple diagnosis and you're very clear and you're very confident on what's going on and what the plan is, and you can speak to that, you're probably okay. But the minute you can say, well, I'm not really sure. Well, I'm going to wait and see what the doctor says.
Okay.
Then it's okay to say, you know what, let's sit down and let's hear what the doctor says together. Let's all talk about it.
Okay.
And definitely when it's a multidisciplinary situation, there's
Okay.
so many pieces going on. Yep.
And when you say multidisciplinary, you're talking about multiple physicians?
It can be multiple just healthcare team members. It could be PT and physician and I'm trying to think of something else. A speech therapist that
Okay.
you have to bring all those people together. It can be
Right.
multiple physicians. Cancer is a very complicated thing where you have a medical oncologist, a radiation oncologist.
Right.
You may have a specialist for your type of cancer. You may
Right.
have a surgeon separate from all those people.
Okay.
And everyone loves to do their thing and their
Right, but whether
specialty.
they're talking to each other is another story.
Right.
And
Mhm.
lo and behold, the electronic medical record is not the panacea that everyone thinks it is, because even though there's notes in there, the other guys have to read the notes.
Right.
So
You still have to click.
yeah, you still have to click. I remember many years ago when I was accompanying a patient to a large academic medical center, and she was receiving cancer treatment recommendations, and this was before COVID, obviously. There was a family. Her daughter was there. I was there. It was several people there, and in a conference room. And I was really impressed. The physicians came in to us, right? So the medical oncologist came in, and then later the radiation oncologist came in, and so it was a cohesive effort. Unfortunately, they should have come in together, right? Because it was here's this doctor, here's that doctor. So it was certainly an improvement into what is happening today. But I did think that was a nice way of at least having the patient stay in one place, and then all the physicians came to her.
Right.
What I would have liked to
Exactly.
have seen is if we all sat together and there would be, a little bit more of an engaging conversation. Okay,
Right.
so your recommendation is doesn't matter time wise. It's whether or not you feel like you are understanding the plan and are feeling
Mhm.
confident of the team.
Correct. You should be able to turn around and tell your family members, this is what's going on, and here's the plan moving forward.
Okay. Okay. And
Because if you're not sure about that, it's okay to ask. That's a legitimate question.
and who should someone ask? So say I'm feeling that way, but I don't know who to ask. Where do you start? What do you recommend?
I think you start with your bedside nurse. That's the person who's right there in with you more often than anyone else. They can actually speak up on your behalf. There's, all the physicians do rounds at some point during the day where they come around with their teams usually and review your specific case. The nurse
Okay.
can speak up for you then. The nurse can bring them into the room. If you're not getting somewhere with the nurse, you go to, certainly anybody that comes into the room, doctor-wise, you can say, hey, I need assistance getting a plan of care or whatever. But there's the nurse manager. You can always request that. There's
Okay.
the case manager. Just because they don't call me back doesn't mean they're not going to talk to you. They will talk to you.
Maybe that's the problem. Maybe the wife should have called.
Yeah.
What about, so you're saying a plan of care, but my experience is, and I don't know if this is the term that you use, but I will encourage folks to say, I need a family meeting.
Yeah.
Right.
Yeah.
So that could
need a
also be
family
another, right. I need a family meeting, or, I want to talk about the plan of care. Either way, because I think that, a lot of times patients or family members don't know what to ask for. Right. So.
Correct. Right. So I need a family meeting, and I mean, it can just be simple. I want to review what's going on.
Right.
I want to and the doctor, the attending physician, whomever, should really lead it. Just as if they're talking to a group of their peers, they should say, okay, your loved one came in, this is what was going on, this is what we determined, this is what we're recommending, and this is the course of treatment we're following, and this is how we anticipate it to go, and discharge plan or whatever. But they can lead that.
Okay.
Just by saying what's going on.
Right.
The family just saying, I need to understand.
Well, and they should be, as we call them, the captain of the ship, right? The attending physician,
Correct.
not the resident. And good kudos to him for saying, I'm just the resident.
Right.
Please don't ask me anything.
Right.
Please. Okay. So families can ask. That's one of your lessons. Can ask. The second is to go to your bedside nurse to at least start the process. And I guess, make sure the attending is there, because that may not always happen. They may try to just bring in a resident or maybe a physician's assistant or a nurse practitioner. We do recommend that you get the attending physician there. Any other suggestions about that family meeting?
There is one other department in hospitals that is available to family and patients, and it's called different things in different places, but it's patient advocacy, patient relations.
Okay.
And in my mind, they're like your concierge.
Okay.
So you should be able to call them and say, I'm having a concern. I don't know what's going on with my loved one. I mean, they should be able to help. They do. They help all the time, and they intervene on a lot of things.
Okay.
So they'll partner with you and sort of be that middle ground person often between you and the staff, you and the physician, nurse manager, whomever. So they're a great resource.
Are they clinical folks? Are they?
I don't believe so. No.
Okay. Just good at conflict management.
Conflict management, a liaison type of person.
Okay.
Right.
Yeah, I do remember a patient, a client calling and telling us that she had used or called the patient relations department. She was living far away from her mom and called, and it was very, very helpful to have them intervene on her behalf. So that was good. So that's a good recommendation as well. Now, there's one other question. You mentioned something about the length of stay that this gentleman had. It was over a weekend. Well, it was several weekends in the end, but over a weekend. Why is the timing of that important? Talk about what your experience has been and what you recommend to patients when weekends are involved.
Weekends. Well, weekends you get it's a lot of changing of staff. There's just from the nursing staff. Sometimes there's weekend teams. Everyone rotates weekends, so it's not. You lose some of the consistency. Physician staff as well. All the staff really, all the departments. They rotate weekends, so you lose a lot of the consistency. Communication, the handoff from Friday through the weekend isn't necessarily as I hate to say it, like as robust as during the week. But there's a different pace on the weekends.
Right. Okay.
And I don't know if that's right or wrong, but you tend to lose some information. You tend to things slow down. Don't necessarily all get done on the weekends.
Right. Yeah. I think that the energy, the rhythm, that's a pretty good way to describe it, because I think that healthcare and health systems try to give people off on weekends. And so those that want to work weekends, or maybe they have a certain specific staff, isn't your full-time staff. So I think that is important. And despite what I've been saying for years, that healthcare should be 24/7, it does feel like the weekend that kind of slacks off a little bit. So in an extended stay, such as you have with your patient, it can matter. So I think it's good to bring it up.
Big difference.
Yeah. Yeah. So any other pearls of wisdom before I say goodbye? This has been very helpful, and I think pragmatic advice for any family whose loved one is in the hospital and struggling either to understand the game plan or a lengthier admission where it does kind of, you lose touch with the what's going on. Any other thing you'd like to tell us?
No, I just want to reiterate, don't be afraid, ask, speak up. Doesn't matter where you are and who you are, and who you're looking to ask or talk to. I mean, we're all just people, and so just ask. And remind yourself that these doctors they really are here to help you. The nurses, they really are here because they want to help you. And so speak up. It's okay.
Okay. That's a great way to end, Jennifer Prater. Thank you.
All right.
Thank you. All right. Thanks for your time. I appreciate it. Take care.
All right. Thanks, Betty. Bye-bye.
Bye. If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.